In October of 2001, I had the privilege of going to New York City and ministering to a group of people who had been in the World Trade Center catastrophe. One woman really impressed me. She spoke to me about how she was on the phone talking to a girlfriend of hers who had been on a blind date the previous weekend, and they were talking about the pros and cons of this prospective boyfriend when the phone went dead as the first plane crashed into the tower that her girlfriend was speaking from. She spoke of the guilt that she had of having her girlfriend on the phone. Why her, not me? She spoke of having nightmares about it, of having flashbacks about it, of not being able to do things because of what had happened, the tremendous anxiety, panic attack, and depressions that she was having. She said she was drinking too much beer to try to help herself sleep at night. And this was just a few weeks after the event. If this went on for more than a month, she would begin to enter the realm of what we're going to talk about on this tape today, which is post-traumatic stress disorder. My name is Dr. Michael Lyles, and my job today as a psychiatrist is to put a face on this term. In the next 50 minutes, I hope to speak on behalf of people like this woman and helping you to understand what it feels like to go through having this problem. Let's begin with a definition. Post-traumatic stress disorder is defined as an anxiety disorder that occurs when someone has been exposed to a traumatic event that results in the person having triggers of memories of that event that intrudes into their life and causes intense fear, helplessness, and horror. About 25 to 30% of victims of extreme trauma, severe trauma, will develop PTSD. The lifetime prevalence of PTSD in this country is about 8%. That accounts for about 5 million adults. That's a lot of people. And unfortunately, we don't pay much attention to these people. We don't think about them enough in our clinical settings as physicians. In fact, these people utilize a number of medical services. It's estimated that about 11.8% of persons going to family care and primary care settings may have PTSD, but it's not something that we think about or recognize in primary care settings or in specialty mental health settings enough. It's estimated that up to 50% of combat-exposed military personnel have some degree of PTSD, and this is a disorder that occurs twice as common in women, particularly because of the impact of sexual trauma on women. What is a trauma? Trauma it can occur from a number of different ways. It can occur from witnessing or experiencing a traumatic event, or it can occur from trying to help someone who is in the midst of a traumatic event, such as a rescue worker, a clergy person, even a therapist, trying to work with someone who's been through tremendous trauma in their lives. I'm reminded of a psychology professor who had to go for a walk beside a stream in a park to calm herself down after listening to the story of intrusive memories and trauma that a combat veteran was sharing with her in a therapy session. It upset her so much that she had to go for a walk. The risk for developing PTSD varies depending upon the severity, the duration of the trauma, and how the trauma was experienced by the person that was going through the trauma. So what are these traumas? What are traumatic events? In your handout, I've listed a number of the kinds of things that characterize traumatic events. It can be a natural disaster, such as a tornado or Hurricane Katrina. It can be an automobile accident. Rape or sexual molestation is probably the #1 reason for PTSD symptoms in women. There's airplane crashes, torture, physical assaults, terrorist attacks, robbery. The unexpected death of a loved one can be extremely traumatizing to someone that's close to that person. Rescue workers we've talked about before. One of the things I was impressed with after 9/11 was how so many of the firemen and the policemen were having trouble because of what they were seeing in the rubble. But military combat is the one that really put PTSD on the map. Witnessing the death or injury of someone is the most common cause of PTSD in males. There was a study in the New England Journal of Medicine in 2008 looking at 47,000 soldiers from Iraq and Afghanistan. Some were deployed, some were not deployed, some were combat exposed, some were not combat exposed. They gave them questionnaires before deployment and then about 2.5 years later. And they found that PTSD was higher in combat exposed troops, 7 to 8% in combat exposed deployed troops compared to 2 to 3% in non-deployed troops. This is consistent with what we've seen in history as, again, military exposure is the thing that defined PTSD. As you look through history, the Civil War talked about the soldier's heart, referring to cardiac symptoms, irritability, and increased arousal that people had during that time period after coming home from war. In World War I, the whole concept of shell shock came into the vocabulary of our country, describing changes behaviorally that soldiers had when they came home, and the theory was that it was due to brain trauma because of shells exploding around their brain. The same New England Journal article, I might add, that I just referred to, described the fact that there may be something to this because a lot of the soldiers that had PTSD also had some sort of symptom of head trauma or head injury with loss of consciousness, which almost tripled their rate of PTSD compared to people who did not have head injuries. World War II brought into our vocabulary the whole issue of combat neurosis or operational fatigue that referred to, again, behavioral changes that people had when they came home from combat. But it was Vietnam, the war of my generation, that really brought PTSD and defined it, as people came home with symptoms that we as psychiatry had not really thought about and studied the way it needed to be. And it was that group of veterans that led to the 1980 definition of PTSD by my profession coming into being. They defined it. That's what put the meat on the bones of this entity.